My name is Thandolwe Tungwahla.
My name is Brooklyn Frederick.
My name is Ngobeko Mthembu.
My name is Margaret Zavute.
We've moved from the Family Healthcare Center on Colorado to helping the student-led initiatives on Skid Row with the unhoused population, as well as the student-run clinic in Hollywood. And what stood out the most is that I didn't fully understand the sheer volume of the unhoused population in Los Angeles, and just how deeply embedded this issue is within the healthcare system.
It was an eye-opener for me to see that there's a lot of people who are marginalized, such as the illegal immigrants and the unhoused population. And also it really blessed me to actually be able to actually lend a helping hand medically to those patients.
I would say on a clinical level, we are more densely overcrowded and less structured in the way that we handle patient care, which leads to us having a limited amount of time with every patient we see. And what I've noticed with UCLA, yes, they may not be so overcrowded, but they had a strong focus on cutting out 40 to 60 minutes to spend with each patient to really get to know what the patient is going through. And I think that's what family medicine is about, connecting with the patient.
To be honest with you, I see a lot of value, because one thing that I've also noted is that yes, people come in and they come in because they are sick, but sometimes it's just a matter of just you listening to the patient speak that can be really healing on its own.
What I found similar between the two settings was firstly the burden of disease, specifically in chronic disease, and just also the impact of the social determinants of health and how your sort of economic provision will determine the kind of healthcare that you have access to.
Yesterday we saw a man who had a skin infection that comes from living on the streets.
Within our encounter with him, we realized that the medical issue was an issue, but it sort of took a backseat to other needs that he had, such as clothing, shelter, food and water. And I think for me, the interaction sort of challenged the traditional biomedical model of health, and it emphasized that effective care sometimes begins with meeting patients where they are.
A lot of them have had this experience in healthcare where they've been overlooked or turned away, or they don't feel safe to come to us.
I think the experience has reinforced the importance of viewing healthcare through a systems and an equity lens. And I think I'll definitely return home with a deeper appreciation of community-based interventions and the role of advocating for your patients in medicine.
We learned a lot because we were given an opportunity to also just see the patients as they see them, ask questions as they consult, examine here and there. So that was really amazing. And we also had an opportunity to also just share the differences in terms of like what we normally do in South Africa in comparison to here. So I think they also did learn a thing or two from us as well.
I was able to share with them as to how to efficiently get to the diagnosis of the patient with very limited resources that we have, compared to how, here in the US it's very easy, just send a patient for imaging, MRI, everything. So I was able to actually share that experience as to how to get thorough diagnosis fast.
I've never had the experience of doing ultrasound myself or doing an echo, and the doctors, even though I wasn't one of the residents who would particularly benefit from this skill right now, they still treated me like I was, and they gave me the opportunity to learn and to practice myself, and that is an experience that I will never forget. It was really great.
One of the things that I really liked the most is intersectoral collaboration, and how specifically with the student-led initiative on the mobile clinic on Hollywood, not everyone was necessarily someone that had a background in medicine, but everyone found a way to all work together with one similar goal in mind.
It was quite beautiful seeing also care being taken to the streets, and it was interesting because you always think that care can only be limited in a medical facility. So it shows that it's actually possible for you can actually deliver any sort of care anywhere. It doesn't really matter the setting. So
I so wish that we can have more students from South Africa to come and actually experience this culture, experience the difference in the healthcare systems, so that we can better improve our healthcare systems in South Africa, and also come and share our thoughts on the American system, so that we can both have some sort of learning and grow our healthcare systems in that way.
I just want to thank UCLA for giving me the opportunity to learn and interact and experience what healthcare can be in a first world country, and also motivate me to come up with different ideas or initiatives to improve our healthcare systems.